Okay, welcome everyone. My name is Shirley and I will be your moderator this evening. I am so excited to welcome Amy Spaulding, Director of Operations at eAssist, as our speaker tonight. This webinar is designed for dental practitioners seeking to streamline their practice operations, improve revenue capture, and provide better patient care. Before we get started, I would like to take a moment to go over some quick housekeeping. If you have a question tonight, please type it into the Q&A box and we will answer them live at the end of the presentation. CE is not available for this webinar. Amy, welcome, and thank you so much for being with us tonight. I will pass it over to you now.
Well, thank you, Shirley, so much. Well, hello, everyone. We're here tonight to talk about decoding the dollar, unleashing the power of outsourced dental billing. And it's part of the webinar series with the Schein Dental Academy. So jumping in, we've invented optimized revenue cycle management and front office services for dentists. So for more than 10 years, eAssist has been able to put a platform together. They've been able to put more money back in the pockets of our dedicated dentists and reduce the stress of their teams. The platform of dental billing specialists, those that work for eAssist, it's over 2,500 dental offices and DSOs that they're working for. And they've collected more than $12 billion from insurance companies, which I know many of you out there, dentists, are looking at that number and thinking, oh gosh, they actually got the money from the insurance carriers? We sure do. So as we're here, just wanted to tell you a little more about eAssist and the awards that they've been able to, over the years, get from these fine establishments here. And it's a top place to work. It's an Inc. 5000 and Inc. 500. And it is the nation's leading dental billing platform. And so eAssist can help your practice succeed by having many different, I know many of you probably think eAssist dental billing, right, and aging, but we also have insurance verification and eligibility, and we have some patient portion statements and billing, and dental practice accounting, bookkeeping, and payroll. Then on some other items here, as you'll see, we've got our insurance credentialing and fee schedule, negotiations, and we also have our full schedule where each of the practices that have that have someone call their patients on their behalf and get them scheduled. So let's talk about each one just a little bit more. We know that dental insurance billing and aging, this is where all the claims are going out of the system, your system, and we're able to send those clean claims out and get those claims paid. And we're posting those payments and we're adjudicating those payments. And if those claims are denied, we're getting that money that's rightfully owed to you. Now, insurance verification and eligibility, this is where in your system, we have a way to really work to take that stress off of your office manager and get these breakdown of benefits and eligibility for you. And then there's the next, which is patient portion. And in that patient portion, we're sending those statements out to your clients and your patients. And then dental practice accounting and bookkeeping. Well, this is every office needs a accountant and bookkeeper, and we're the ones that do this really well because we focus just with dentists. So we know all of the things that dentists need. And then the insurance credentialing. If you have a new associate join your practice, or if you're starting a new practice, we're here to help do that. And our fee schedule, our full schedule, again, coming back with getting those patients on the schedule. So a little bit about me so that you kind of know where I'm talking from. I've got quite a number of years in the dental field now, and have worked both front office and back office. and a little with the DSO groups, and really have been here with eAssist now for a little over 2 years, and really seeing how they help practices like yours really get that money that they're owed and bring peace of mind to that dental office. So our learning objectives for tonight that we're hoping you're going to learn is identifying and understanding what challenges might be sitting in your office today that you don't even know are real challenges, and that there's people like eAssist to come in and help with. I'd like to tell you what those are and evaluate some of the benefits of having an outsourced dental billing company work for you, and also explore the processes of security of having an outsourced dental billing. So let's get into those. The first one is the challenges, right? And I'm sure many of you have this. I'd love to, if you want to put in the chat how many of you have this, right? There's staff turnover. I think it's like one of the number one items that we're hearing now is, I don't know what to do. My team is leaving. They aren't wanting to work here in the office on site, or maybe I'm growing my practice so fast and I can't find anyone that can work, right? And really just trying to figure out, how do I get that new person trained up? How do I really get them, I'm paying them and maybe I'm not seeing the results. And then who's really responsible and accountable for your AR in your office, right? You're doing all that dentistry, you're producing all of that great work for those patients, and who's ensuring that that money's coming into the practice? So with all of this, those responsibilities, they pile up. And what we find is when we consult with clients like yourself, we find that there's quite a bit of AR and it's piled up. And we've got some work to come in and help do to get it nice and clean. And then from there, take it forward. Any of you have that? Then there's this, there's manual data entries and errors and incomplete and inconsistent documentation because things are going so fast, especially in those offices where you have many patients coming in and you're a high producing office, and who's making sure all of the notes on all of those claims are being followed up on, right? And then having the denials and making sure that somebody is really fighting for that dollar. And how about this one? I think we've all been here. Patient calls the office and says, I don't understand why I have to pay this. And a lot of that time and effort on the phone, being with that patient on the phone, instead of being with the patient in front of you, right? We can really, these are what we see as some of the biggest financial challenges. But the biggest that we see is, of course, compliance issues and embezzlement. It's at a very high rate when we have a client that we come in and we do a consult with, and then we kind of look through the system and we see what is there. We're able to really pinpoint out some things and some compliance issues that could possibly hurt the overall practice. And so as we're looking at that, you want to just talk about that's the issues, but what's the cost, right? Your salaries of your dental billing staff members, their healthcare costs, their federal and state taxes that you've got to pay, you've got to train them, and any other ancillary cost is like your office space. I know many of you are building these beautiful practices, and the square footage is so important, and making sure that you have enough room in the front, right, where patients can sit and also your staff can work, and making sure that you have that office space. And that's dollars per square foot is really something that we take for granted sometimes. But when you start adding it all up along with paper and office stationery and all of that, it looks something like this. And this example of the cost for in-house, this is an insurance coordinator. We were able to grab some sources of the BOLI and ADA and dental claim support. But as you can see here, the average wage for a in-house insurance coordinator is $22. And it will actually cost you between $45,000 and $64,000 a year, depending on benefits. And then if you have them as that, overhead cost and beyond their salary, the compensation that of taxes and Social Security and all of those things, you can actually expect the total compensation to be about 25 to 40. I know that's a big span of percentages there, but that is where it could end up being higher than the employee's base salary. So really you're looking at about $57,000 per year, excluding benefits. So an office with only one coordinator costs about $60,000, right? So if we're looking at that, and you see that in-house person with a monthly draw of about $47,000 there, a remote team is about half, much more there. And what you're able to get, we're going to go into with that remote team. So some benefits, right? We don't call in sick. There's a whole team that's always providing billing, and claims are filed every business day. Our staff turnover is then, our problem, not yours. And so our training, again, we vet our specialists with experience, and we know what they're trained on, and they're put on teams accordingly. We're paid not hourly like that in-house team, but we're paid on our results. So our model is set up so that you're paying based on a percentage of what you collect, and we want to help you collect it. And so if we're both in that same mindset of we want to collect every dollar that's due to you, because we also get paid on that dollar, it really shows such a big difference in what is paid in eAssist offices and to eAssist offices, especially from carriers, than those that aren't. And then you have, the time, right? That front office person, insurance coordinator, even office manager, if they're doing that dual role for you up front, there's only so much time in a day where we have enough time and a dedicated team of many people that we can put on and get everything cleaned up so that the AR is nice and clean. If those responsibilities are piling up, then appeals aren't getting taken care of, and you're missing timely filings to appeal, and things like that is what we see most often. But we are on top of that every 14 days. We're looking at those and making sure that if we've sent in an appeal, where is it? How is it? Hey, knock, knock, right? Calling that representative, making sure that it's being processed. And then I know we talked a bit about this, but we have insurance against embezzlement and compliance issues where you run the risk of doing that on your own. So that's something to take into consideration here. And one of the greatest things that we see when we come and visit offices, because sometimes we're out in the field and we're walking into the offices and saying, hey, let's sit down and just talk for a bit, and what's the best thing? And we have these dentists tell us all the time, well, just the customer service to my patients has gone through the roof, because my in-office team now gets to focus on those patients and growing my practice, asking for those referrals. How many of us have been here, right? You're talking to your team and saying, we're going to ask every patient for a referral of friends and family. And then the phone rings and the patient is walking out the door and they're just waving and saying, I'll call you later, right? Well, if that phone is there and they're on the phone with a carrier and they don't want to hang up when that patient is brought up, right, to check out. Now that's all removed. They have that undivided attention to have that conversation, ask for those referrals. And then, patients aren't receiving surprised bills when and leave the practice, right? We know what's coming when we bill out the claim so that we can get that back to your office to have some of those conversations if we see that something isn't done right in the practice management system. And we also have our patient billing team that will call the patient and say, hey, today, you left and you didn't pay. We can take that payment, and here's how to do it. And everything is secured that way for the payment to be taken and financial peace of mind for you all. So that's the challenges and the benefits there. Here's our results on that AR for dental billing and follow-up. Our average practices running at about 145,000 over 90s. And after a month with us, they're at about 34,000. Such a big difference, right? We're able to go in and find those claims that aren't getting paid and really within that 30-day cycle, get those insurance carriers to pay what's rightfully owed to you. And then after 12 months, we're sitting at about 12,000 and over 98 insurance AR. This is where the insurance carriers are asking for certain items and taking a little longer to process certain types of claims that go into that over 90s. And really looking at this is our average results. We have some that are much, much better, but this is our average. So the collection ratio, right? That 14%, and it's 143% after 3 months. These are such great numbers. And each office is individual, of course, right? Maybe you're really have your AR nice and clean, but you're looking for someone to take over that because, you want to start to grow your practice. And when somebody's focused on what is there all the time, then the growth mindset kind of goes away. And so we found that just opening that up, even if your AR is clean, it allows the growth of your total top line revenue to grow. Now, we talked about numbers here, but let's talk about those managers in the office, right? This poor lady here, she's done. But we definitely remove those distractions for them so that they can really focus on patient care and even patient care, but also really maybe team building with your team too. For those of you that have larger practices, right? Where you're running a team of 10, 12 staff, that office manager is trying to do all of this, plus do some leadership and development. And we want to make sure that we're preventing that burnout. We want to be part of her team. We want her to know, and for you to know, or him, I guess, to know that we've got it and we're bringing peace of mind. And we're the best staff member on your team. And if we can do that and take off these tedious processes, it really, really opens it up. I've heard more office managers say to us, thank goodness. Thank goodness. If my doctor didn't have you, I don't know where I'd be, but we're a better team because of it. So really just keep an eye out on those managers, okay? So let's talk about how it works. We actually connect right into your practice. We have a remote connection that we use. It's a VPN, and the number of connections needed will be determined on the size, of course, of the team that will be needed to work on your actual AR or your insurance verification or your patient full schedule, right? Calling those patients. There's two different approaches. There is that VPN, and we'll talk those through during your launch call, but VPN is the most secure there. So we come into your dental software and we are able to kind of come back and do this full suite of revenue cycle services that way, right? We're able to kind of get into your dental software, and we know when we say your dental software, we know them. There's many, probably a little over 50 dental softwares that we now know and have staff that know. And in those dental softwares, we know how to do these things. We know where to go look for your claims. We know where to go look to make sure that those claims are clean. They went out the door nice and clean. We have all the information on them to send them to the carrier to get them back. And we know where to post those payments and how to post those payments. And we'll do it on what we call a launch call with you. You would tell us, this is how I like my things done. And we know how to do that inside of your system. And then we've got that patient statements and billing, right? Reaching out to those patients and making calls and sending statements and letters. And then insurance verification, we'll kind of jump into that a little more here in just a minute. And our dental accounting and bookkeeping. And then again, credentialing and fee schedules, and our full schedule, our recall and retention. So this is our dental billing. And again, clean claims, posting EOBs, doing everything in their power so that nothing goes over 90s, right? Our insurance account balance is near zero. That is our goal. And in that, here's what we say. If you were to have us as the outside billing service for you, we're going to collect 100% of what's rightfully owed. Those claims are going to be clean. We're going to post all those payments to the ledger. Here's the good part: within a business day, right? They're not stacking up. And then we're going to follow up every 10 business days on all claims that are over 30 days old. And we're going to get your over 90s near zero, and we're going to keep it there. And how we do that is we also have detailed reporting for transparency. So you and your office manager will get this report every day. It's going to tell you production and collection ratios, outstanding claims, outstanding insurance receivables, and your patient accounts receivables. There's lots of things on this one. It's a pretty cool report. And we find that many of the dental softwares hold this information in like many different places. So we pull it all together and serve it up on this nice, beautiful report for you to see. It really helps to ensure that your team is staying on track and meeting goals. One of the perks for us is Practice Booster. And I'm sure you've all heard of Dr. Blair's Practice Booster, but to assist you in choosing just the right CDT codes, we offer Practice Booster's online advisor to all of our clients at no additional cost. And then with that, right, so you have those claims and you know how those claims are going out, and then you have that dental advisor. Let me come back there. You have this dental advisor and it says, gosh, I wonder if I can build this code with that code and what will happen. And not only will this code advisor help, but our team on our side is going to see something like that also, because they're really trained in this and know what can and cannot be cross-coded and what can and cannot be, a payable benefit under certain carriers. And we're going to tell you that before we just send that claim out the door. We want to make sure that we're not wasting your precious resources or ours, and we have that information. So we want to learn and kind of come back and say, hey, doc, this is how you might want to think about coding this, and what do you think about this procedure? Now, the procedures are done, and you're charting and charging, of course. But when it comes to sending that insurance claim out, we want to make sure it's nice and clean. So that's just some additional information there because eAssist and Practice Booster is powered by eAssist. We're all in the same family. Sometimes many clients don't know we do insurance verification, and I've heard throughout the country, different offices, and through my tenure is this is the one. Like if you get this right, then everything down the line just flows, right? If you know that that patient has a MetLife Boeing plan as an example, right? And if you get that and everything that that plan covers and what it does not cover, we know that. We're able to get that information for you. We're able to fill that out and have that specific details so that when you are charting and charging a procedure for that patient on that MetLife Boeing plan, you know what MetLife is going to pay and you know what the patient owes. And so this one, I think, is a little underrated for us, and it's well worth mentioning here to all of you. We can actually put the data directly in your system. So we'll complete all the verifications 4 business days before the patient's appointment. And we're going to input all the coverages, percentages, maximums, deductibles in that practice software that you have. And in doing that, we're going to ensure that the remaining maximum and deductibles are accurate, right? And we're going to verify that that information on that form is filled out completely. We have our form, and that form will also be attached in your practice management software. And then we will go and transpose that into your practice management software. That's one way we could do it. That one's a little more costly. And then the one that isn't is, we have a form, we fill it out and we upload that to the office, and it's HIPAA secured and has everything that I just showed you on the last slide. But some don't want the data entered into the system. They just like it and they can pull it up and manually coordinate the treatment plans from there. So in delivering peace of mind, right, we always show this. One of the founding principles that Dr. Anderson had when he built eAssist was really delivering peace of mind for clinicians. And then it went, oh, well, we're delivering peace of mind not only for clinicians, but we're also doing that for the managers and for the patients. So as we walk through then, would love to hear from all of you. If someone from our team could reach out and talk to you about any of the things that we discussed today, there is a poll that's up right now. We'd love to talk more to you if you're interested, or if you have additional questions about some of the services that we have. And so that poll is there, and if you want to go ahead and answer that, I'll give you a minute or two. Well, thank you for filling out that poll. There's also this, Henry Schein's Dental Academy, we're part of that webinar series, and you can see here that they have a business solutions team at Henry Schein. And if you'd like to scan this QR code to learn more, or to schedule a complimentary consultation with that business team at Henry Schein, here's that. They also have a number here that they've provided. Give you all a second to pull up those phones and take grab that camera and scan that code. I'm gonna now hand it back over to Shirley and open up for questions and answers here.
Thank you so much, Amy, for a wonderful presentation. I would now invite our participants to please go ahead and enter any questions that they have in our Q&A chat box. And I will give you all a moment to put those questions in there, and then I will be reading them to Amy. So please go ahead and put some questions in there. We'd love to answer them. And also, Amy, are there any common questions that you might get that, any questions that you can think of that come up that you've seen often and that you have some good answers for?
Yeah, I think one of the more prominent, questions is cost, right? It's usually on everyone's mind. How much does it cost? Depending on your practice and depending on which service, All of our brochures are online. You can look there for sure, and it'll tell you where maybe you fit with your collections and numbers and those types of things, or how many insurance verifications you'd like to have done for your practice. I have found that when people look at the brochure, then that triggers some more questions like, well, how do I really find out these numbers, and are they accurate? And so that's really where, reaching out and doing a consultation. The consultations last about 20-25 minutes with our business solutions team, and they really are able to look into, guide you to look in your software and find those numbers so that they can tell you what that fee is.
Well, if there aren't any other questions tonight, we can go ahead and wrap up. And again, thank you so much, Amy, for a wonderful presentation this evening. And thank you all for joining us tonight. We did record tonight's webinar, and we'll email the recording out sometime in the next week. And we'd love to get your feedback via our survey that will pop up shortly on your screens. Thank you all for joining us, and we look forward to seeing you very soon on future webinars. Have a wonderful evening. Thank you. Thanks, Amy. That was
Bye.
great. Bye-bye.